Hello, everyone. It's Monday, August the 16th. Again, I offer up, for people to have these folks in prayer. We've lost two more individuals. To be perfectly honest, that's good news in a lot of ways, but it's always tough for these folks. And so if you'd please remember in prayer, the 2,977th death is a 62-year-old female from Putnam County, and the 2,978th death is a 66-year-old male from Raleigh County. Now, stay close with me about this. Our new positive cases, we'd like to see them under 200. We'd like to see them even less than that, way less than that. We have had 1,482 new positive cases since we were here on Friday. 1,482 new positive cases. Our daily positivity rate number, which we like to see it at 1 point something, is 9.14. Cumulative continues to grow just slowly, and that's how it will do because it's a cumulative number of all the days, but it's at 4.96. Our active cases that we got down well under 1,000. Our active cases in West Virginia now are 5,949 cases. Recovered cases almost 165,000. We now have 369 people hospitalized in West Virginia, and 127 of them in the ICU units. Everybody should listen. We're going to have more people die. That's all there is to it. With 5,949 active cases in West Virginia, more people will die. We only have 10 counties in the green: Barber, Berkeley, and Wetzel in the red. It's time to be on your toes, West Virginia. It's time absolutely to be vaccinated. If you're 65 and older, you absolutely, without any doubt, if you have any symptom at all, whether you're vaccinated or not, you need to go get tested. Because we can save your life with these antibodies, but you need to get tested. Now, we are making some progress as far as vaccinations. And since Friday, we vaccinated 7,100 folks that had not been vaccinated. 7,100 doses were given out since last Friday. The total number that we've given out of first-round doses in West Virginia is 1,089,226 people. We have now reached another milestone that is unflat believable. We have 90.1% of our folks in West Virginia that are older than 65 and older that have received their first shot. 90.1%. It's great work by all those folks that are out there in the field. We have 83.5% of the 50 and older, and we are right on the threshold of having 70% of everybody that is eligible 12 and older. 69.9% right now. So congratulations to all those out there in every area that are working hard to get the 65 and older across the finish line. You did it. You've got them above 90%. Gosh knows we'd shut this thing down in a heartbeat if we had everybody at 90%. So you still got to continue to help in every way, but anybody that's 65 and older, we need that number now to we'll just keep at it and keep at it and keep at it. Let's try to move it to 95. I mean, it's unbelievable to be at 90%, 90.1%. As far as the booster shots in arms, we moved early on that. We at least made more awareness. And last Friday, the FDA and the CDC authorized COVID-19 vaccine booster shots for people with a weakened immune system. And we immediately began administering those extra doses. Our local health departments and pharmacies are giving them out right now. Our highest priority is getting those doses to those who need them the most. We are working through how to report these booster shots, and once we get that figured out, we'll get it up on the dashboard. From day one, again, we've been the leader in the vaccinations, and we're going to continue to just keep going in that direction, and we're surely not going to stop now. We have 322 Delta variant cases in West Virginia. I want to remind you again how effective the vaccines are. The eligibility is 12 and older. Your second shot is absolutely so important. We need to work more and more and more on our young people and get them vaccinated. I tell everyone, this is all there is to it. If your children are heading back to school and they're not vaccinated, that's not good. Absolutely, you're taking a chance. And absolutely, if you're a grandparent and the kids that are going back to school, your grandkids are not vaccinated, please help me, because we need to get them vaccinated. All the vaccine info line stuff is up there and everything. As far as the face coverings, I have not, at this time, I have not issued any mandatory face covering requirement at this time. There's people all across this nation, just scurrying in a lot of different directions and everything, and there's lawsuits floating around everywhere about the mandate on top of the mandate, and we believe in local control and our counties and our school boards, and let them make decisions because they know what's going on right there with their constituents and everything, and they can do that in a great way. We feel very confident in everything. However, we absolutely believe without any doubt that one size doesn't fit all, and but we're continuing to monitor, and if need be, we'll move. But right now, we do not think we have to move in that direction. I remind everybody about the free testing, and the free testing map is up. I encourage everyone to take advantage of it. I thank Walgreens and Fruth all the time. They've done great. They've been great partners. We have 21 outbreaks in our long-term care facilities, 13 outbreaks in our church community in 12 counties now. I've told you over and over and over, the church community is absolutely an area where we've got to watch. It's in Cabell, Fayette, Jackson, Jefferson, Kanawha, Mason, McDowell, Nicholas, Putnam, Raleigh, Taylor, and Wayne counties. Okay, at corrections, we have 28 inmates and 15 staff. 20 of the inmates, 20 of the 28 are at Stevens Correctional Center in McDowell County. I remind everyone and ask you to be kind enough to consider giving blood, especially if you have had COVID and you've recovered. There is a blessing that has been laid upon you, and you need to at least consider stepping up and giving blood and maybe giving the gift of life to somebody else. Now, there's a tropical storm coming, and it's not, it probably, when it gets to us, it won't be a tropical storm. It'll just be, some heavy rain. We've got to watch in our mountains about all that. I have declared a state of preparedness for all 55 counties in West Virginia due to the threat of flooding that can very well happen from this, and so we need to watch out because this is going to move into our area, and probably on Wednesday. The main threat will be the possibility of isolated flash flooding, and you don't need to mess around with this. Don't drive through water and everything. I mean, absolutely, moving water, driving through it is extremely dangerous, or any water, But our state emergency operations center is coordinating our response and preparing resources that can be activated, and the emergency management division will coordinate with all county and local emergency management teams and everything and provide updates. So that's all I've got. Again, many, many prayers. 2,978 West Virginians we've lost. Please keep all those folks in your prayers, your thoughts, and your love. And if you know these folks, please reach out and talk to them. Okay, that's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Rehashing a couple of things the governor said, that we are continuing to see more new cases of COVID-19 across West Virginia. And importantly, the age groups that we see a higher intensity of spread is in the 30 to 50-year-old age groups. And these are the age groups where across our country, we have been seeing more people hospitalized in hospitals, in ICUs, and on ventilators. The other thing that we're seeing around the country is today in the United States, we have more children that are hospitalized than any other time during the pandemic. And as we have talked about before, because our older population is well vaccinated relative to our younger population, we are seeing that those individuals are more protected. Certainly, there's still some older West Virginians that are hospitalized, but more protected than people that are younger related to vaccination status. And so we look across the country, we look at our children, we look at our young adults, we look at our 30 to 50-year-olds, then we find that the majority of people in hospitals around America and in West Virginia are those that are not vaccinated. When we look around the world, in Israel, they've gone from 200 cases about 2 months ago. They are now at 50,000 cases. They are still seeing a more severe problem in unvaccinated or partially vaccinated people, but they have been the country that has been the most aggressive about following with third vaccines as the FDA and CDC just approved for our immunocompromised individuals. Israel now has moved to their over 50-year-old individuals who have been vaccinated 5 months ago or longer with their second dose. And also now, based on doctors' order and verification by their their health ministry, that they are now also immunizing children 5 to 12 years old who are at high risk of having complications. One additional note, and I'll be done. In the state of Tennessee, over the last 6 weeks, they have gone from 200 people hospitalized to 2,000 people hospitalized. In many places in Tennessee, they have no beds, they have no ICU beds, they have no hospital beds. And so as we look at West Virginia, this is really the defining moment for us in many ways as we see COVID-19 growing in West Virginia, particularly the Delta variant. We see our hospital numbers going up. We see our ICU numbers going up. We see the number of people on ventilators going up. And we know that the Delta variant is really starting to take hold. It is over 91% of our new cases at last measure. And so we can anticipate that this variant will continue to infect more people in West Virginia. And as we've said many times, the governor just re-said, but I want to reinforce this, that the really critical cornerstone of our program to help secure the health and the well-being and save the lives of people in our state and preserve our hospital beds and capacity is full vaccination. And then in people who are fully vaccinated, and absolutely in anybody who is not yet vaccinated, please consider wearing a face covering, a 3-ply face covering, that when you go into crowds, when you're with people that you don't know, or when you're indoors, because as we've said, the mask reduces the amount of droplets that are formed by 40 to 60% and protect you from inhaling those droplets to get sick about 20 to 30%. So the more people that wear masks and the more people that are fully vaccinated, the more West Virginia remains safe, the more we are firewalls to the spread of the variant, and the more that we're doing our part, not only for ourselves and our families and communities, but for our state, our country, and our world. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. I'd like to reinforce a couple of key points that the governor made. It was, in fact, a strong weekend for vaccines. To get over 90% of our 65-plus population is truly an amazing thing that we have pulled off together as a state. To be at 83.5% first doses of 50-plus is truly amazing. But as the governor pointed out, we cannot stop. We cannot stop. We need to continue to raise that, as well as in our other age categories, particularly our younger West Virginians. As the governor pointed out, 369 hospitalizations currently for COVID. That is an 11% increase from the last time that we reported that, West Virginia. If we continue this pace at that pace in less than 2 weeks, we would hit the maximum number of hospitalizations for COVID that we hit during the last surge. We have got to get this under control. And as Dr. Marsh pointed out, vaccinations are key to this. We've got to continue to move forward. A couple of items just to report to make sure folks understand. We continue to work our interagency task force, which includes all of our partners, state, local, and federal, working with nursing homes to make sure that we move forward in an appropriate manner with the booster doses as well as with antibody testing. There have been a lot of good movements that have occurred over the last several days, and we will continue to press that, because we know we need to follow the governor's top 2 priorities, which is reduce death rates in West Virginia, as well as maintain the integrity of our hospital system. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I just wanted to give a short update on the Hilltop Nursing Home in Fayette County. There has been some progress. We have 1 patient and 1 staff member who's still in isolation. The rest of the patients have recovered. And while we did have some unfortunate patients that did pass away, we did have some, recover. We had patients that did recover from that, but we just wanted to give an update on that. And a lot of questions did arise from that. There were Delta variants from that, but we just want to remind everyone to get vaccinated, and that our hearts are with the family members who lost their loved ones from that nursing home there. But thank you.
Thank you, Dr. Amjad. And finally, to Secretary Bill Crouch with the DHHR.
Thanks, Jordan. Hello, everyone. As we reported last Friday, the state surveillance system went through a significant upgrade last week that's caused a lag in cases being reported to the dashboard. This update has created some additional problems that were unforeseen, but it's slowed down case reporting in some counties. Our dashboard team worked into the very late hours this morning and are continuing to work all day to verify these final cases. Total number of cases will increase significantly as these were cases from the 5-day period, which began from last Thursday. That update was done last Wednesday. Due to this issue, you'll notice on the next update, which may be this evening or maybe tomorrow morning, will be approximately 700 new cases added to the dashboard in addition to new cases received over the past 24 hours. We apologize to those who followed the changes on the dashboard, and we're working hard to fix those issues as quickly as possible. Thank you.
Thank you, Secretary. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media. Mark, you're still muted. Mark, could you try your question one more time? We think you're on mute.
Like we had St. Francis in Charleston.
You got to start it one more time. All we got was St. Francis and Charleston.
Well, is there a possibility we're going to have to open a surge facility with all these new hospitalizations coming, either at St. Francis or elsewhere?
General, maybe you can answer that, sir.
Yes, sir, Governor. So, Mark, Secretary Crouch, Dr. Amjad, Dr. Marsh, myself, others from the team have been meeting on a regular basis with the Hospital Association and are working with them and their members to be prepared to address a possible surge requirement. So your question is a good one. As we continue to see 11% a day increase in hospitalizations. We are working closely with those folks. And one of the things that the governor has directed us to do this time is to work more closely with them related to letting the hospitals at their level manage surge capacity, and then for us to provide the support level that we need to make sure that it works from a state level. Thank you.
Thank you, Mark, and we apologize for that audio issue. I think we've got it cleared up now. We'll go now to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. This is for the governor, I think. Governor, I was going to ask your level of concern, but you say you're always concerned, so I'm not going to waste your time with that. But with reports that there are some possible outbreaks in school systems already, we've just started in reports of teams being quarantined in the central part of the state and large numbers of people being separated away because of possible exposure. Does that nudge you toward a line to where we're going to have to change the policies for schools, or is it still more of a wait and see attitude? And let's see how this thing's going to play out. Thank you.
Kenny, you hit the nail on the head. You know, I am always concerned. And I think right now we're still in the kind of wait and see. You know, Kenny, it's a really, I mean, you talk about, they're all tough decisions, but from the decision of, you know, going back to mass or going to virtual or whatever the situation may be, you know, any kind of decision like that, there's repercussions all over the place. You know, there's bombs that go off everywhere, because when you fragment, and I've said that so many different times, but that's what's got us to where we are. We've been able to stay together. And if we start breaking apart and everything, it'll be bad. Now, our kids need to be in school. I mean, that's all there is to it. And we do not want to awaken to a school year like we've gone through last year. Again, there's already going to be a link in the chain that may be off, you know, may be lost forever with our kids. We've already got last year's link maybe gone. Well, you know, for a lot of kids. And now, with all that being said, I am wholeheartedly behind we need to be in school. We're going to continue to monitor, and we're going to try to get work caught up and everything in the world we can do to help kids all across the spectrum. But yeah, Kenny, I'm concerned. I am absolutely concerned, and we need to we'll continue to leave those decisions to a local level as long as we can see fit that they're doing the job that has to be done. But yeah, Kenny, I just wrote this down, you know, as we were just starting the questions. And I wish everybody could really dial into this, because I wrote, I can't believe that I am having to ask people to go get vaccinated to try to save their life. You know, do we want another school year like we had? Do we absolutely want just a meltdown with all of our sports and everything like we had? I mean, do we want to continue? I mean, just think, we've got 5,949 cases, and maybe even a whole lot more than that are active right now. Absolutely, do we believe that we're going to get out of this and nothing bad's going to happen to these people? Well, of course stuff bad's going to happen to a bunch of them. Now, so I'm respectful in every way of people's rights and people's opinion of being vaccinated or not being vaccinated. But I am telling you, Kenny, I just can't believe that we're going to disrupt our schools. We absolutely are continue to lose people. We got more people hospitalized than we've had in a good little while. And yeah, I'm concerned. You know, we're just going to keep it up and keep trying. And every day we get a few more across the finish line, but we just got to keep trying.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for the healthcare folks. The governor has said that, any mask mandates, any, mitigation strategies like that he puts in place would only be on your all's recommendation, on the recommendation of the healthcare experts. So could you tell us specifically at what point will we need to make those recommendations to the governor? What numbers are we looking at that will tell you guys that you need to make that recommendation? Thank you.
Okay, Dr. Marsh, maybe you can start.
Yeah, I'm happy to do that, Governor. Well, Charles, thank you for that question. And as we have said very, very consistently, based on CDC guidance, we basically recommend that each vaccine eligible person, decide and choose to be fully vaccinated with one of the 2 messenger RNA vaccines, Pfizer or Moderna, and that in areas of high spread, which is the governor has shown across the country, that people also consider to add, safety for themselves and for others by, choosing to wear a mask or a, well-fitting face covering that has 3 layers that you can't see through, because we know that reduces in the amount of droplets that are formed. And reduces infectivity in an indoor environment and a crowded environment, and may also protect people from breathing in, other people's, droplets that they may be producing, even if they don't know they're infected with COVID-19. Certainly, as we go forward, we talk to the governor constantly. We update him on what we're seeing. As opposed to a specific single metric, we are watching the spread of COVID-19 in West Virginia. We're certainly watching these congregate settings, as the governor has suggested, and Superintendent Birch and Deputy Superintendent Blatt have talked about, that the decision may be more appropriate to leave at a local level, and that is that's the pathway that is being followed. But we are updating the governor all the time. He is watching the numbers as we are, and so the governor and Superintendent Birch and the school boards, the county school boards, are making the decisions they feel are right for the children. And as we go forward, this unfolding process that we are seeing with COVID-19, and particularly the Delta variant, of course, is having us all worried. And, we would suggest, importantly, that, families and individuals should not only wait for a mandate, but should take that precaution set for themselves and their families and their communities that they feel will best serve them, best protect them. And as they do that, they protect others. One other real quick point, it is also important, even in people who have been infected with COVID-19, they consider getting vaccinated. Recent study from Kentucky demonstrated that the protection is 2.34 times more, twice as much, a little bit more than twice as much with vaccine after infection versus people that have just been infected with that immunity alone. So it's important for all vaccine eligible people to please get vaccinated.
All right, thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Kind of ask kind of a blunt question here, but I'm a little. On one hand, I'm hearing, the numbers are up, which they most definitely are. Hearing we're concerned about an increase in deaths that could come from that. That's a lagging indicator, but we've seen cases going up since the beginning, really about the second week of July. We haven't seen an uptick in deaths. I think we can credit the vaccination rate, particularly the high vaccination rate among older West Virginians, for keeping death numbers where they have been. At least. So on one hand, we're on one hand, I'm hearing that concern. On the other hand, I'm hearing, well, we're not ready for mask mandates. don't really need to do anything else at this point. So I guess my question is, are we talking out of both sides of our mouth to kind of appease two different groups, those that obviously don't want to go back into mask mandates, and frankly, the same people that are vaccine hesitant, versus the people that frankly would probably want to see us not only go back to mask mandates, but probably take even further restrictions as well? Are we trying to appease both sides on this? Thank you.
Stephen, you know me, I always try to answer your questions as bluntly, not give you a political bunch of stuff and everything, but yeah, you're right. You're right. We're absolutely trying to appease both groups. And the reason we're trying to do that is we're trying to keep everybody moving together. That's what we've done, Stephen. We've kept everybody together. We got 7,100 people vaccinated over the weekend, 7,100 folks that hadn't been vaccinated up to now. Well, a bunch of those that we got vaccinated that hadn't been vaccinated up to now have changed their mind because they would have already been vaccinated. You, I'm sure agree with that. But a bunch of those folks did change their mind. Without any question, I'm trying to skate right across the razor blade. You know, the easiest thing would be, okay, let's just do mandates and let's go right straight to mask and everything else right now. And it may make things better, but really and truly, right now, there's not a clear enough evidence from our medical team and everyone to just move immediately right to that. But absolutely, you're right. I'm trying to skate that razor blade and trying to make it to where every day we get a few more, just a few more across the finish line. If we can just keep up getting a few more, and we got that 7,100 is a whole lot more than a few more, but absolutely they had to be a bunch of those people that decided to go get vaccinated that hadn't been vaccinated before and that hadn't already been vaccinated. And it's easy to say, well, you know, we had to get a bunch of folks, a bunch of people vaccinated that were just stubborn or who had decided that they weren't going to do it, and then they decided to do it. So, yeah, Stephen, we got to absolutely continue, in my opinion. We got to either make one or two choices. We got to run the risk of absolutely fragmenting us and going in a lot of different directions, and that could cause a lot of harm, or try with all in me to keep everybody moving in the right direction together. And I choose the latter.
Thank you, Stephen. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, I want to take this in a little different direction, but perhaps following up on all the questions we've had so far. Basically, you're selling vaccine for no cost. And the sales process has always been you identify the objections and then you overcome the objections to get there. Have you done a survey as to what the objections are outside of the general's hell knowers? And what have you heard, maybe even anecdotally, that you could put a sales effort into those people to overcome their objections, whether they're legitimate or not? Thank you.
Well, Paul, Paul, if you've got any suggestions, we'll surely listen. You know, I mean, you've got those that you described as the hell knowers. I'm sure we got some of the hell knowers across the finish line over the weekend. But you've got a bunch of kids that were, you know, just think they're invincible and that they just decided that they're not going to, they just don't have time in their life. They can't slow down enough in their life to get across the finish line. You know, Paul, every state is dealing with exactly the same thing. And we see this variant and just running through everywhere. But Paul, any suggestions that you would have, we'd surely listen. But, you know, we are trying anything and everything in the messaging. and the other part of your question is, have we looked into why they're not getting vaccinated? Well, sure we have. And there's everything in the world. There's everything you can imagine, as a reason. Just like I've said over and over, I was sitting there at a table with 5 very intellectual folks that were from 40 to 70 years of age. 4 of them hadn't been vaccinated and these were business owners. They believed in their mind that there was something in that vaccine that was going to allow them to be traced by the federal government. Every one of them had a cell phone. I mean, you can't make sense out of it. But yet, there are many, many, many great people that absolutely have different opinions, and we need to continue to just, I think, stress all of the goodness and all of the repercussions that are happening and can happen if they choose not to get vaccinated. The biggest thing that I would appeal to all of our kids is just this. You went through a terrible year last year, and you could very well go through a terrible year this year. Absolutely, some of you could absolutely get extremely sick, and some of you could end up with side effects for the rest of your life. Absolutely, your school can be disrupted, your sports can be disrupted. Without any question, you could get really sick, and God forbid you could possibly die. And then on top of that, there are kids that are going to get sick that can end up with side effects that will carry with them the rest of their life. Absolutely, without any question. If you're a parent and you're not getting those kids vaccinated, I highly recommend you do so. But Paul, there are 1,000 reasons why somebody out there is opting out not to get vaccinated. Is there an absolute reason beyond, people's just, you've got a bunch of people out there that, I always say this. Let me just say it's like this, okay? And that is, doesn't misery love company? Isn't that the way it is? And if you have someone out there that's not vaccinated, I'll promise you, in many ways, they're advocating to people that may get vaccinated that maybe they shouldn't get vaccinated. Instead of just standing on the sidelines, a lot of times they're cheerleading people to stand with them and not get vaccinated. Well, that hurts us too. But maybe General Hoyer's got something else, that he'd like to add to this. But Paul, we're doing everything that I know we can do. But any other ideas, just please tell us. General.
Yes, sir, Governor. I can add, Paul, as the governor points out, we have done research with the folks from WVU Media Lab, as well as other surveys that we've done. And unfortunately, there is a broad spectrum. There are those who, as you've pointed out, I call the hell no's that just will not get vaccinated. They're not a significant percentage of what we've seen so far in numbers. There are those who just need more education from a trusted primary care provider or pediatrician. There are those who are just so overwhelmed with caring for children, or grandparents who are caring for children who we need to continue to take vaccines to. And there are just a spectrum of folks out there who still are waiting for FDA approval, that final nod that says this vaccine is safe and effective. So a broad spectrum, as Governor points out, he continues to push us daily to get different ways to get to those various groups of people and continue to vaccinate West Virginians. Thank you.
Thank you, Paul. Next to Kelsey Soto with WSAZ.
Good afternoon, Governor and team. We're hoping to get some information on the booster shot that was recently announced last week. I know Kanawha started their soft rollout this weekend. A lot of questions there about if this is going to be tracked or counties prepared to begin doing that, and kind of how you see this playing out in the next few months.
General, please.
Yes, sir, Governor. So Kelsey, yes, you're right. A number of counties have started, as well as a number of pharmacies have started. The team from the DHHR data analytics team, as well as in our task force, are working with CDC and others to identify the best way to track the booster versus the two-shot series. It's going to take a few days for us to work through some things, but I can give you an example of a clinic in Kanawha County this weekend that provided 135 booster shots in one clinic. Those kinds of things are going on across the state. And as I mentioned earlier, we are working final coordination with our nursing homes to continue to make sure we get, as we did in the beginning of this pandemic, we lead the nation in getting booster doses to our most vulnerable residents. So we'll continue all those efforts. Thank you.
Thank you, Kelsey. Next to June Leffler with West Virginia Public Broadcasting.
Hi, Governor and panel. If I could just follow up on the booster shots, I mean, can we get a specific number of booster shots that were given out in the state this weekend? And for those people that are immunocompromised, what exactly do they need to do to get this shot?
Okay, General, you're popular today, but it's Kelsey. Is that correct? June. I'm sorry, June. If I could just add one thing real quick, June, and it's just this: is over the weekend, I doubt many people really knew that everything was a go and we were administering these shots. But let's try to get the word out, and then, General, you can tell everybody where to go and how to get online or whatever, and determine what they need to do to get this shot. But for the people out there that are that have difficulties with their immune system or whatever, and especially if you're 6 months out, or we really need you to think really hard about getting the booster shot, and we need to get it to you. So General, go please.
Yes, sir, Governor. So June, we're working with counties and pharmacies, and again, there's a variety of different inputs that occur that the state and federal level are still working on. So don't have an exact number of total booster doses today, but we will over the next couple of days give you more information related to that. This weekend, Dr. Amjad, as our public health commissioner, put out guidance that went out to a variety of providers related to the immunocompromised and those who can get the vaccine, as well as some specific categories within that. And as the governor points out, we encourage everybody who believes they are immunocompromised to go and work with their county health departments and with their providers and their pharmacists to get those booster doses available. Thank you.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, well, I think we've had a lot of concentration, today on the concern about the number of active cases that we have in West Virginia, the number of hospitalized, the number that are in the ICU units, and I think we're doing the right thing in the number of people that we got vaccinated over the weekend at 7,100. That's really progress, and that's good. But I tell everybody again exactly the same thing. We need for you to understand one thing, and understand this loud and clear. There is nothing in your life right now, if you're not vaccinated, as important as getting vaccinated. Nothing in the world that I can imagine nothing in the world that would drive me to the point of basically allowing a disruption in our school year, allowing disruptions in our sports. We're getting ready to go, we've got people at the state fair right now. We got people getting ready to go to football games, whether they be Marshall, WVU, whatever it may be. Absolutely, we got to get vaccinated. There is nothing in your life, in my opinion, as important as this. It'll save your life. It could save someone in your family's life. It could absolutely save someone that you know. And if not be that, it's going to cause terrible disruptions if this continues and it continues on the path that it's been on so far. Now, look, this thing is not, if this is the graph, this thing is not moving in this direction. This thing is moving in this direction. And as long as it moves in this direction, it's going to get worse and worse and worse on all of us. We need you vaccinated. You got to help me. You got to help me every step of the way. I respect you in every way. I understand your rights, and I have total respect. But absolutely, do we not need to love our neighbors? Do we not need to do that? That's what the good book says in every way. And our neighbors need you vaccinated right now. Think about it. Please, please, please try to help us. Thank y'all.